Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Start with this idea. Quitting smoking is not one heroic decision. It is a sequence of small actions repeated at the exact moments when the brain is asking for nicotine. Why does that matter? Because smoking addiction is not only a habit of the hand, it is a conditioned medical pattern involving brain reward circuits, withdrawal, stress response, memory, routine, identity, and social environment. Nicotine reaches the brain quickly, stimulates reward chemistry, and teaches the brain to connect cigarettes with coffee, driving, meals, work breaks, loneliness, celebration, anger, and relief. That is why a person may say, "I do not even want this cigarette," while still reaching for it. The National Institute on Drug Abuse describes how nicotine exposure can create long-term brain changes with withdrawal symptoms after stopping and cues linked to dopamine surges in the reward system. So do not begin by saying, "I must change my whole life today." Say this instead, "I will interrupt the next cigarette." Why? Because addiction often wins by making the future feel too large. Small actions shrink the battle to the next minute, the next craving, the next breath, the next choice. How do we use that? We build a quit system so small that the addicted brain cannot easily argue with it. Listen carefully. The goal is not to prove that someone has perfect willpower. The goal is to remove friction from healthy choices and add friction to smoking. Do not wait until motivation is dramatic. Do not wait for fear. Do not wait until life becomes calm. Take one small action now, then another, then another. This is how a person moves from being controlled by cravings to becoming the person who can watch a craving rise, peak, and pass. First, understand what you are fighting. Ask, why is quitting so hard when everyone already knows smoking is harmful? Because the cigarette is not just delivering smoke, it is delivering timing, memory, expectation, and temporary relief from withdrawal. The CDC explains that two tasks happen at the same time. The brain must adjust to being without nicotine, and daily routines must be rebuilt without cigarettes. So command number one is simple. Separate the chemical craving from the routine craving. Say it out loud. This is withdrawal. Then say, this is a trigger. Why should you name it? Because naming turns a foggy urge into a visible process. If the craving appears after lunch, after coffee, or during stress, do not call it destiny. Call it a cue. How do you answer a cue? Replace the old sequence with a new sequence. Use the pause and replace method. When the urge comes, do not negotiate with it. Stand up. Drink cold water. Breathe slowly. Move your body for 2 minutes. Text one person. Chew nicotine gum if it is part of your plan. Step outside without lighting anything. Wash your hands. Change rooms. Put distance between the trigger and the cigarette. Why do such small moves matter? Because the addicted brain expects an automatic chain. Cue, urge, cigarette, relief. Break any link in that chain and the chain weakens. Now ask, how can a tiny delay help against a strong craving? Delay changes the meaning of the urge. If you say, "I can never smoke again," the brain may panic. If you say, "Not for the next 5 minutes," the brain has less to fight. Then repeat. 5 minutes becomes 10. 10 becomes the end of the craving wave. This is not childish. It is neurobehavioral strategy. Cravings often feel permanent while they are happening, but they are biological events, not commands. Command number 2, build your quit environment before the crisis. Remove cigarettes, lighters, ashtrays, and emergency packs. Do it before bedtime, not during the craving. Why? Because when withdrawal is high, decision-making becomes more vulnerable. Make the right behavior easier before the difficult moment arrives. How? Prepare a small kit, water, sugar-free gum, toothpicks, a stress ball, nicotine lozenges if appropriate, a written reason to quit, and the phone number of someone who will answer. Now bring in the medical evidence. Do not depend on willpower alone if you have access to treatment. The US Preventive Services Task Force recommends that clinicians ask adults about tobacco use, advise stopping, and provide behavioral interventions plus FDA-approved pharmacotherapy for non-pregnant adults who smoke. It concludes with high certainty that these approaches provide substantial net benefit. So give yourself this command: use treatment without shame. Why should medication be considered? Because nicotine withdrawal has a biological component. Nicotine replacement therapy can reduce withdrawal symptoms, and counseling can help a person design a quit plan. The CDC also notes that combining medication with behavioral counseling improves the chance of quitting. How do small actions fit with medication? Perfectly. Medication lowers the volume of withdrawal. Small actions retrain the daily pattern. The patch may steady the body. Gum or lozenges may handle sudden urges. Counseling may expose the hidden routines. Text support or an app may interrupt a lonely moment. A quit line may turn a relapse into a rapid restart. Do not choose between science and self-discipline. Combine them. Now ask another why. Why do many quit attempts fail after a strong start? Because the person prepares for the first day, but not for the ordinary Tuesday 2 weeks later. Smoking often returns through tiny doors. One stressful phone call, one drink, one argument, one cigarette taken from a friend. So use tiny doors in the opposite direction. Write one if-then plan. If I finish a meal, then I immediately brush my teeth. Write another. If I feel stress, then I breathe for 60 seconds before I decide anything. Write another. If someone offers me a cigarette, then I say, no, I'm not smoking anymore, and I hold water in my hand. Why are if-then plans powerful? Because they reduce the number of decisions required under stress. The brain loves automatic behavior. Smoking used to be automatic. Make recovery automatic. Now look at the body. Why should anyone believe small actions matter when cigarettes have already caused years of exposure? Because the body begins repairing earlier than many people imagine. The CDC summarizes that after the last cigarette, heart rate drops within minutes, blood nicotine falls to 0 by 24 hours, carbon monoxide drops to non-smoker levels within several days, coughing and shortness of breath decrease over 1 to 12 months, and risk of heart attack drops sharply within 1 to 2 years. Over longer periods, risks for multiple cancers and coronary heart disease continue to fall. So do this. Measure progress in biological wins, not only in cigarette counts. One craving survived is a win. One smoke-free morning is a win. One meal without smoking is a win. One stressful message answered without lighting up is a win. Why? Because the body is not waiting for perfection before it responds. The healing process begins with the first interruption. Now, let us address relapse with medical honesty. If someone smokes after quitting, do not say, I failed. Say, I collected data. Why did it happen? Where were you? Who was there? What emotion appeared first? What was the cue? How fast did the cigarette follow the urge? What could interrupt it next time? Do not turn one cigarette into a full return. Stop the slide immediately. Throw away the pack. Call someone. Restart the same day. A 2024 randomized clinical trial in JAMA examined people who did not quit after initial treatment with varenicline or combination nicotine replacement therapy. It showed that adjusting treatment, such as increasing varenicline dose for certain known abstainers, can improve outcomes after an initial lack of success. The lesson is practical. If the first plan does not work, do not disappear. Adjust the plan. Ask, how do we make the first week survivable? Use a 4-part daily script. First, protect the morning. Do not start the day with a cigarette. Drink water immediately. Move your body. Eat something with protein. Why? Morning smoking is often a powerful dependence marker and a strong routine anchor. Break the anchor early. Second, protect transitions. After meals, after work, after calls, after driving, act fast. Stand up, change location, put something in your mouth that is not a cigarette. Use the medication as directed. Why? Transitions are where cigarettes hide. Third, protect stress. Do not promise yourself a stress-free life. That is not a plan. Instead, rehearse a stress response. Inhale slowly, exhale longer, lower your shoulders, name the feeling, and delay action. How? Say, "This is anger, not a cigarette order." Say, "This is anxiety, not an emergency." Say, "This feeling can pass without smoke." Fourth, protect night. Before bed, write one sentence. "Today I did not smoke during." Then name the moment. Do not write a novel. One sentence is enough. Why? The brain needs evidence that the new identity is real. Now consider social support. Do not quit silently if silence has failed before. Tell 3 people exactly what to do. Say, "Do not offer me cigarettes." Say, "Ask me at night if I stayed smoke-free." Say, "If I text the word craving, send me one reason to wait 10 minutes. Why be that specific? Because vague support becomes polite encouragement, but specific support becomes a safety rail. Also, involve a clinician when possible, especially if you smoke heavily, have depression, anxiety, cardiovascular disease, pregnancy, other substance use, or previous severe withdrawal. Ask about nicotine replacement therapy, varenicline, bupropion, counseling, quit lines, and medication safety. Do not self-prescribe prescription drugs. Do not mix methods without guidance if you have medical concerns. How do you turn this into action? Make the appointment before your quit date. If you cannot see a clinician quickly, contact a quit line or trusted health service and begin with behavioral support. Now let us make the method clear. Small actions are not small because the addiction is small. They are small because repetition is the language the brain understands. Smoking became powerful through repetition. Same cue, same behavior, same reward. Recovery also becomes powerful through repetition. Same cue, new behavior, new reward. Why does this work? Because every interrupted cigarette is a lesson written into the nervous system. I can feel this urge and not obey it. Do not romanticize the cigarette. It does not solve stress. It relieves the withdrawal and tension that nicotine helped create. Do not let the brain sell you the idea that smoking is a friend. Ask, "If this were helping me, why does it demand to be repeated all day?" Ask, "If this were freedom, why do I feel pressure when I cannot smoke?" Then act. Drink water. Step away. Use treatment. Call support. Breathe. Wait. Repeat. So here is the closing instruction. Do not aim to become smoke-free through one grand emotional moment. Build smoke-free minutes. Build smoke-free routines. Build smoke-free mornings. Build smoke-free stress responses. Why? Because a life changes when the smallest repeated behaviors start voting for a new identity. How do you begin today? Choose one cigarette you will not smoke. Remove one trigger. Prepare one replacement. Tell one person. Write one if-then plan. Ask one clinician or quit support service for help. Then repeat tomorrow. Remember this, the craving may be loud, but it is not law. The urge may feel personal, but it is also chemistry, memory, and routine. Treat it medically. Treat it practically. Treat it with patience. And most of all, treat each small action as a serious act of recovery. Take care of yourself, take care of each other, and keep your circle close. See you in the next topic, like family moving forward together.